Welcome to The Explainer. Today, we're diving into a really fascinating study about treating severe osteoporosis in patients with Duchenne muscular dystrophy. Now, this is a group of patients who face some of the most incredibly complex challenges when it comes to bone health.
Okay, so here's how we're going to break it down. First, we'll get a handle on this really tough medical dilemma and see why the usual treatments just aren't cutting it. Then we'll look at a totally different way to think about bone health, check out the pretty groundbreaking results from a new trial, and wrap up by talking about what this all could mean for the future. All right, first up, the devastating dilemma. We're about to look at this cruel catch-22 situation in medicine, where the very treatment that helps these patients live longer actually ends up causing serious harm to their bones. So Duchenne muscular dystrophy, or DMD for short, is just this relentless genetic disorder. It's a constant uphill battle against muscles getting weaker over time. And really the whole goal of medical care is to just hold the line, to manage all the complications and keep the quality of life as high as possible for as long as possible. And this is where things get really complicated. It's what doctors call the glucocorticoid paradox. See, the main drugs they use, glucocorticoids, are absolute lifesavers. They keep patients walking longer, they help their heart and lungs work better. But, and this is a huge but, they come with a devastating trade-off. They absolutely wreak havoc on the skeleton, causing severe osteoporosis and leading to frequent, really painful bone fractures. So you've got this terrible side effect, and there is a standard treatment for it. But as we're about to see, for a lot of these young patients, it's not enough to stop the damage. For a long time, the go-to drugs have been something called bisphosphonates. You can pretty much think of them as the security guards for your bones. Their whole job is to be anti-resorptive, which is just a fancy way of saying they slow down the cells that are always breaking down old bone. The goal is to stop the demolition crew from working so fast. But here's the problem, and it's a big one. This defensive strategy just has too many flaws. When you have patients on a high-dose steroids for years and years, just slowing down the demolition isn't going to cut it. The damage keeps happening, the fractures continue, and, this is the most important part, these drugs do absolutely nothing to rebuild the bone that's already gone. This failure is exactly what pushed researchers to try a completely new approach. So if your security team isn't holding up, what's the next move? Well, what if instead of just playing defense, you could actually bring in a construction crew? That's the big idea behind a totally different kind of drug, which this study tested for the very first time in these DMD patients. And that's where teriparatide comes in. Now, unlike the other drugs, this one is an anabolic agent. It's not just about preventing breakdown, it actively kicks the bone-building cells, the osteoblasts, into high gear. It tells them to build new bone. This is a total shift in strategy, from just trying to save what's left to actually constructing a stronger skeleton from the ground up. Now, this was a small study, but it was really pioneering. It followed just 6 young men, about 18 years old on average. But look at their history. They've been on steroids for an average of almost 11 years. 5 out of the 6 couldn't walk anymore. And get this, every single one of them had a history of fractures, even though they were on the standard treatment. This was a true test in a group that was at incredibly high risk. So the million-dollar question, how did this bone-building approach actually do? Let's get into the results, the good, the bad, and the really interesting stuff. The results were pretty striking, to say the least. The biggest benefit they saw was an almost 90% drop in the rate of long bone fractures, the awful breaks in arms and legs. The rate just plummeted from 0.84 fractures per patient per year before the treatment down to just 0.09 during it. That is just a huge, huge improvement. And it wasn't just the long bones. This chart here brilliantly illustrates another key success. It's showing the health of every single vertebrae in the spine for all 6 patients. The green triangles and the blue circles, which mean the bones either got better or stayed the same, vastly outnumber the red ones. And for patients who are so prone to these devastating spinal compression fractures, just holding the line like this is a massive win. Now here's where it gets really interesting. The treatment didn't actually increase their overall bone mineral density, or BMD. And you might think, wait a minute, isn't that the whole point? Well, not exactly. You have to remember, these patients are fighting against severe muscle weakness and years of steroid use. It's almost impossible for them to build bone mass like a healthy person. The fact that their fracture rates dropped so much without a big jump in density, well, it suggests the drug might be improving the bone quality and its internal structure, which is something a normal bone scan can't even measure. Okay, so what about safety? Were there any side effects? The most important thing is that overall, the drug was tolerated pretty well, but it's not totally without risks. A known side effect is getting high levels of calcium in the urine. And in this study, one patient who already had that condition did end up developing a kidney stone. This is super important because it shows that while the drug has promise, it requires really careful monitoring. All right, let's zoom out and put it all together. After looking at all this data, what's the big picture takeaway from this small but really important study? The researchers themselves really said it best. This is not some magic bullet cure, but it is a vital proof of concept. It shows that for these patients where the standard care has failed them, a bone building anabolic approach can make a real world difference in preventing fractures. And that gives a really strong reason to do bigger studies. And so, this explainer really leaves us with a hopeful question. For a community that has had to live with this painful paradox where life extending drugs destroy their bones, we now have real evidence that a new strategy, one focused on construction, not just defense, could be a pivotal shift in protecting their future.